Hi everybody, thank you so much for taking the time to watch this video. The information in here could help you save a life.
Okay, first and foremost, most allergic reactions do not look like this. Of course, there may be some similarities. There may be swelling of the lips, swelling around the eyes, or some redness, but someone does not need to look like this to be in a really bad way. Medical journals state that anaphylaxis is an acute, life-threatening, systemic allergic reaction. This can lead to cardiorespiratory arrest within minutes. For those affected, the threat of further episodes can lead to significant lifestyle restrictions and psychological consequences. Allergy or anaphylaxis. It's important to know the difference. Obviously, an anaphylactic reaction is a medical emergency, while an allergic reaction is usually not a medical emergency. You may see similarities. The person with anaphylaxis may also have itchy red eyes or swelling around the eyes. They may have hives or an itchy rash, but that will generally be along with something else. So, an allergic reaction, most of us have seen these. I think it's around 33% of people have at some stage in their life suffered from some kind of allergic reaction. It's a runny nose, maybe itchy, red, watery eyes, some kind of rash, and maybe a local reaction. So, for example, if it's a bee or a wasp sting, the actual swelling is where you would expect it to be, as it's where the sting is. Now, of course, unless this person is known to be allergic, you probably don't have to worry. However, if someone has a local reaction and then it starts growing, or they then start to get other symptoms as well, then we need to be treating this as a more serious event. Allergic reactions can indeed progress into full anaphylaxis, even if the person has never had anaphylaxis before. So, anaphylactic reactions could be some kind of swelling, face, lips, something to do with the airway. Now, this can obviously be invisible, so it can present in things like, particularly looking for in children, if they keep swallowing, as if they're having some kind of slight discomfort in the throat. They may have a change of voice. Their voice may become a little bit hoarse or maybe a little bit deeper or a little bit more harsh sounding. They may, without even thinking, be touching their throat, particularly at the base of the neck. Sometimes that's where the swelling can start. The person may have vomiting, diarrhea, or cramping. Now, cramping sounds like something that could be attributed to a myriad of different things. However, this is severe cramping. They may have it in conjunction with vomiting, diarrhea, or just on its own. That can actually be a sign of an anaphylactic reaction that can quickly lead to other problems as well, such as difficulty breathing, chest tightness, and some kind of cardiac problem. They may be weak or pale, they may be sweating, and this one's an interesting one, feeling of impending doom. Now, this is one that I have had when I've had anaphylaxis. Some people say it's the drop in blood pressure that can do it, but this feeling of impending doom is one of the more strange symptoms of anaphylaxis. So if we just look at the signs of anaphylaxis that we've just studied on the previous slide, most of the reactions involve the skin and the airway, and these are the ones that we typically will look for. However, we do need to look at the ones on the right-hand side here, where it involves the central nervous system, the cardiovascular system, and the GI tract. So, of course, if any of this happens or you suspect that this is happening to anyone, remember they may never have had an anaphylactic episode before. This is an EpiPen. It's very easy to use, and I will explain more about that later in this presentation. So if we're looking at the time when we inject the epinephrine, which is the EpiPen, if we have any one of the following severe symptoms, something to do with the lungs, the heart, the throat, mouth, widespread redness over the body, gut, or some kind of feeling of anxiety and confusion, we definitely need to inject the EpiPen. Milder symptoms, nose, mouth, a few hives or mild itch or mild nausea or discomfort, something we don't need to definitely give the EpiPen. However, if they have more than one of these, they definitely need to be continually monitored. And if any of them get worse, then definitely give the EpiPen. Let's look at my favorite, some common misconceptions. Allergies and anaphylaxis only affect a few people. No. From 1992 to 2012, the rate of anaphylaxis has risen by 615%. Hospital admissions for anaphylaxis have continued to double in the previous 10 years. Allergic diseases are affecting the lives of more than 1 billion people. So while we're in the midst of a pandemic, they are also calling this a silent epidemic, where the prevalence of allergies is just continuing to rise. They expect it will reach 4 billion in 2050. If we look at who is affected, 6 to 8% of children and around 2% of adults. So this is an interesting thing. If someone has anaphylaxis previously, and let's say it affected their throat, and that's how they knew it was anaphylaxis, what can happen with exactly the same trigger to exactly the same person is it can present in a totally different way. So anaphylaxis is at risk of being missed because of this. So the first time, maybe it was swelling of the lips and the feeling of tightness in the throat. And the next time they've got severe stomach cramping and some hives on their body. This is probably one of the most important things that anyone with anaphylaxis or severe allergies needs everybody to know. It's a common misconception that a tiny bit won't hurt. This couldn't be further from the truth for many people. Even if someone has touched the allergy and then touches a person, that could be enough to trigger life-threatening anaphylaxis or an allergic response. A simple thing as cutting a vegetable for dinner on the same chopping board as the allergen could be enough. Even before it's cooked, cooking does not take away the allergen proteins. This is one that's common in the movies, so you just need to have an EpiPen and you're good to go, right? Absolutely not. All suspected anaphylaxis cases must go in the ambulance to the emergency department for monitoring for at the very least 4 hours. Even if the person is feeling better, the heart needs to be monitored in case it has been affected by the adrenaline, and they can often have a biphasic, which is a secondary reaction, and this does occur in about 10% of people. This is when the body thinks that the body has been re-exposed to the allergy and repeats the chemical discharge, and the person goes back into anaphylaxis. If you have allergies, it means that you weren't exposed to enough dirt as a kid. This is another lovely common misconception. No one knows why severe allergies occur, and there are many studies which have produced inconclusive results. I, for one, was brought up on a farm. If a person just suffers from an allergy such as hives, then we don't need to be worried, right? If a patient has had a significant allergic reaction in the past, so let's say last time they had this food, they were covered in hives. If they then have that food again, any future reaction is likely to be more severe. So even if they are exposed little bit by little bit by little bit, their reaction each time can get more severe, so that when they do eat a larger chunk of this food, they can go into full-blown anaphylaxis. The most common food allergens: peanuts, tree nuts, seafood, milk, and egg. And you can see there, these are the number of fatalities that are caused by these allergens and whether they're children or adults. If the anaphylactic state starts, it can become life-threatening in seconds. It's very common that each anaphylaxis to the trigger will be worse than the previous one. So if in doubt, use the EpiPen.
This is an EpiPen. Sometimes they look a little bit different, but the function is basically the same. The big thing you need to remember is if you suspect even slightly that someone is having a severe allergic reaction, you need to get hold of their EpiPen or one of these as fast as you can. What you do is you flip the top off. You've taken the blue cap off. Remember, blue to the sky, orange to the thigh. Okay? Then you grab this kind of real meaty bit of the thigh there and you would stab it into the thigh. You hold it there for at least 3 seconds, take it out and rub the area. If they've got thick jeans or anything on, do not worry. The needles in these things are pretty brutal and pretty big and thick. But if the person is in anaphylaxis, they probably won't even flinch. I know that when I've been in anaphylaxis and I've been stabbed with one of these, I don't feel it. So do not worry about hurting the person. You are saving their life. And remember, as soon as you have injected this, or as you are injecting, if you've got somebody else there, they should be calling an ambulance. Someone who has had an EpiPen then needs to go to the hospital. Thank you so much for taking the time to watch this video.